Thousands of people across the country and on Vancouver Island today raised their voices in solidarity. They gathered to urge the federal and provincial governments to pay for a contentious treatment for patients who are suffering from multiple sclerosis. The province has kicked in $700,000 for research, but local groups say more needs to be done and done now. And they're hoping the new health minister will be the key to bringing liberation treatment to Canada. A News reporter Louise Hartland has the story.
Well, she had the procedure, and I have the love of my life back.
Lauren Powell can't believe how much his life has changed in just 8 months. That's when his wife traveled to San Diego for a controversial procedure called liberation therapy to minimize her symptoms of multiple sclerosis. Neither can their 12-year-old son, Noah.
She can walk really fast. She can get into my dad's truck really easily. And she can do a lot of things on her own now without me helping.
The trio drove from Nanaimo to send a message to the provincial government. Make liberation treatment available to people living in BC and across the country.
I was this close to asking Mom if I could move in, and now that's not in my future at all.
Today's rally was organized by Shara Grice. She's 34 and has been living with MS since she was 20. Simple tasks such as walking the dog or doing dishes were a struggle until she raised the $10,000 she needed to travel to New York for treatment. After the 45-minute procedure and 2 hours of recovery,
I literally jumped off of the table, which is something that I haven't been able to do in the last 13 years of my life. My mom had to try to catch me because I was doing lengths of the hallway showing off my new moves.
The procedure widens veins by using a type of angioplasty, allowing blood to flow freely from the brain to the heart. Some doctors believe it could help minimize the symptoms of MS. The province's stance has long been cut and dry. More research needs to be done before liberation treatment can be offered here. After a closed-door meeting this afternoon with Shara and other people who have researched and gone through the procedure, the new health minister is offering some hope.
When you are confronted by the kind of folks that I met with today, it gives you a real sense of urgency to move as quickly as possible.
But he says more work still needs to be done.
We're going to continue to pursue and try to speed up as best we can the assessment of the data, and if it's possible to come to a conclusion as quickly as possible, and if that leads to broader availability for the treatment, then I think that's their ultimate objective.
And that's exactly why these people vow to keep fighting for freedom through a procedure each says has changed their lives. In Victoria, Louise Hartland, A News.